Hi, I'm Jarrod Watson, Family Nurse Practitioner, and welcome to Patient First Direct Primary Care. Our mission is to use our God-given talents and genuine love for people to provide our members with the best primary care experience in Southern Oregon. I made the decision to leave corporate medicine and open my own clinic when I was asked to double the number of patients that I see per day. It was already difficult to get my patients in for appointments, and I felt horrible asking my patients to go to urgent care because I didn't have time in my schedule to see them for acute needs. Opening in my own clinic has provided me the opportunity to reestablish that patient-provider relationship and give each patient the time and attention that they deserve. It used to be you'd go to your appointment, you'd see your primary care provider, and your insurance company would pay the majority of the bill. You had a great relationship, you could trust them, you could get in when you need to be seen. Now what's happened is big corporate healthcare systems answer to the insurance companies. The insurance company says, hey, healthcare system, you've got 5,000 of our patients. We're going to pay you 40 cents on the dollar for your appointments with our patients. If you want the rest of that money, you need to make sure that all of our patients who have high blood pressure have their blood pressure well controlled. If they're diabetic, their hemoglobin A1C needs to be down to 6.9. If they're over 45, you need to show us that they've had their colonoscopy. And so what happens is the healthcare systems incentivize their providers to see more patients per day and to make sure that they're meeting all these metrics. So by the end of this whole ordeal, you may have 5 minutes left to talk about what's important to you. So why would somebody come to Patient First over a corporate clinic? First and foremost, access. We block our schedule to make sure we have time to see you for acute problems when you need to be seen. If you have a UTI one morning, you can call and be seen the very same day. No more phone calls to your primary care being told you have to go to urgent care because there's no access available. We make sure that we can see you the same or next day. We do video visits, phone calls, in person, and we also, in some cases, will see you in your home. If you just have a quick question, you can shoot us an email or a text, and we'll get back to you the same day. Another advantage that we have is longer appointment times. Every one of our appointments is 30 or 60 minutes long to make sure we talk about what's important to you. Our establishing appointments are 2 hours in length to make sure that we get your information correct and that you leave here feeling heard. And lastly, what makes Patient First truly unique is 24/7 access to your provider. If it's a weekend or a holiday when a lot of things happen, you are able to get your questions answered by somebody who knows you and cares about you. You're not going to be calling the on-call doctor who may get around to getting back to you or is really irritated that you got them out of bed and has no idea who you are. You roll your ankle at 10 p.m. on Christmas Eve and you don't know if you should go to the ER, your provider is just an email or a phone call away. So you're probably asking yourself, how do I become a member and how does this all work? Patient First doesn't bill insurance or Medicare or Medicaid. All of our members pay a monthly membership fee to cover the costs of our services and our availability to you. What's the best way to get a hold of Patient First Direct Primary Care? The method that's best for you. If you prefer a phone call, 541-393-9848 or visit our website at patientfirstdpc.com. So if you're not receiving unparalleled access to your provider and excellent customer service, we invite you to come and experience the Patient First difference.